Can telehealth prescribe controlled substances? Have you ever wondered if you can get prescriptions for controlled substances through telehealth? It is a question many young people are asking as virtual care becomes more common. Let's break down the facts to help you understand how this works. Telehealth providers can prescribe certain controlled substances, but there are specific rules to keep in mind. Controlled substances are medications that the government regulates because they can be abused or lead to dependence. They are classified into schedules from Schedule I to Schedule V based on their medical use and risk of abuse. Schedule II substances have a higher potential for abuse, while Schedules III to V have lower risks. In recent years, especially after the COVID-19 public health emergency, the rules for prescribing controlled substances through telehealth have changed. Healthcare providers registered with the Drug Enforcement Administration can prescribe Schedule III to Schedule V controlled substances via telemedicine for certain conditions. This means you can receive medications like buprenorphine for treating opioid use disorder without needing an in-person visit first. When a telehealth provider prescribes these medications, they can give an initial supply for up to 6 months. This supply can often be split into multiple prescriptions. After this initial period, you may need to have an in-person evaluation or an authorized follow-up via telemedicine to continue receiving these prescriptions. Before prescribing controlled substances, providers must check the state prescription drug monitoring program data. This step helps ensure that medications are used safely and to prevent misuse. They also need to document this review. When you go to pick up your prescription, pharmacists will verify your identity using government-issued identification. Now, when it comes to Schedule II substances, the rules are stricter. Generally, telehealth providers cannot prescribe these without a prior in-person evaluation. However, there are proposed new frameworks that might allow some clinicians to prescribe Schedule II to Schedule V controlled substances through telemedicine under specific circumstances. This could be helpful for those who find in-person visits difficult due to location or health issues. It is important to note that these rules can vary by state and federal law. Some states may have additional requirements or restrictions. For young people navigating telehealth, this means you can access certain controlled substance medications through virtual visits, especially for addiction treatment or specific conditions. Telehealth makes it easier to get timely prescriptions while ensuring safety through monitoring programs and identity checks. However, not every controlled substance can be prescribed via telehealth without an in-person visit. Some medications will still requiring you to see a healthcare provider face-to-face. Always make sure you are using legitimate telehealth services that follow these regulations to protect your health and privacy. If you need prescription refills for controlled substances, telehealth providers can often manage these remotely. They will still follow the same rules regarding monitoring and verification. Overall, telehealth has made it easier to access controlled substance prescriptions under regulated conditions. Understanding these rules helps young people use telehealth services confidently and responsibly.